Our nurse enters the room and washes her hands. She provides privacy for the patient and identifies herself. She then identifies the patient and explains the procedure in which she will be performing. She then asks our patient to move to the scale. Here she can determine his weight and height. This will allow her to determine and interpret his BMI. 0 to 18 is below weight. 18 to 24 is normal. 25 to 30 is overweight, and above 30 is obese. During this time, she will also ask the patient a series of questions, including the date, time, and possibly the president. This will allow her to determine level of consciousness. As you can see, our patient is alert and oriented. She now asks the patient to bend over and touch his toes. This allows her to inspect the spine for curvature and symmetry. Our nurse will now begin vital signs. Vital signs that will be taken will be temperature, pulse, respiration, blood pressure, and O2 saturation. Our nurse will be using a manual blood pressure technique in which she first will palpate the radial pulse. This will allow her to determine how high she should blow up the blood pressure cuff. Our nurse is hoping to find our patient's vital signs within normal limits. Normal limits are respirations 12 to 20, temperature 97.8 to 99, pulse 60 to 100, O2 saturation at the elevation in which we live should be above 90%, and blood pressure should be somewhere between 110 and 130 systolic and 70 and 90 diastolic. She will now inquire with the patient regarding his chief complaint and about his recent sleeping habits. She will ask the patient if he is having any pain with his complaint. She will ask him about location of his pain, the quality of his pain, such as sharp, dull, and aching, and ask him to use the 1 to 10 scale to rate his intensity. She will now palpate the hair for even distribution. She will examine the external ears for any masses or lesions. She now checks the pupils for equal dilation and accommodation. She inspects the mouth for moisture and any lesions. She now asks him to shrug his shoulders, stick out his tongue, smile, and raise his eyebrows, checking for facial symmetry. She is now going to use her finger and ask the patient to follow it, checking his cardinal gaze. Our nurse is now going to palpate and then auscultate the carotid artery, listening for a bruit. She will inspect the chest, asking about any pain or cough the patient may be having. She will listen to all 4 heart valves, and she will auscultate for lung sounds in all the lobes on the anterior and posterior chest. She will examine the skin and determine that it is warm, dry, and intact. Our nurse will now examine the upper extremities. She will interview the patient about pain or tingling. She will inspect the skin and nails. She will palpate radial pulses, noting equality intensity bilaterally. She will also check cap refill bilaterally and have the patient squeeze her hands to test for strength and range of motion. She will now examine the abdomen. She will interview the patient about diet, nausea, pain, and about his current bowel movements. She will inspect the skin and symmetry of the abdomen. She will auscultate the aorta for signs of a bruit, and she will listen for bowel tones in all four quadrants. She will then palpate the abdomen and will find that it is soft and non-tender. She then moves to the lower extremities of the patient, again interviewing him about any pain or tingling he may have. She will inspect the skin and nails of the lower extremities, note the presence of any edema. She will palpate the pedal pulses, noting equality intensity bilaterally. She will check cap refill, and she will check for unilateral calf swelling and pain defined as the Holman sign. She will then check the Babinski sign, which should only be present in infants. Our nurse will now converse with our patient regarding any other lab assessments she may have taken including x-rays, urine tests, or blood samples. This concludes our adult assessment.